We're going to be talking about our scholarly concentration programs. Today, we're talking about CE Med, IMed, and UMed. And don't worry, I'll drop the link for part 2 right after we're done speaking. Now, there's a few housekeeping components that I want to cover today. This is a webinar. It'll be recorded and we'll send it out to everyone just in case you have to step away or perhaps you can't stay to the very, very end when we have all of our question and answers. Speaking of question and answers, we do have a Q&A function at the bottom of your Zoom screen. Please use that to submit questions you have. We're going to hold all the questions until the very end, but if during the presentation for CE Med or IMed you think of something, feel free to just drop it into that Q&A and we'll make sure to get to it at the end, in addition to all the questions you submitted ahead of time. So I'm going to go ahead and turn it over to Dr. Miri to refresh us what are exactly our scholarly concentration programs.
Thank you so much, Bridget, and welcome everyone. We're so excited to host you tonight to share with you about our scholarly concentration programs. What are the things that you need to know about application to the scholarly concentration program? So I want to share with you that these are unique curricular add-ons that are available to all of our applicants at the time of application to the College of Medicine. These are optional and they're selective. So we only have capacity for a third of our student body to join the program. You can combine these programs with any of our joint degrees, including our variety of master's degrees, as well as the doctoral program that we have, the MD PhD program. You can apply to as many of them as you want, and you do have to select one to pursue. Now, don't be too dismayed if you have to select one. We have really academically generous program directors, and they will work with you to have projects that can straddle more than one of the areas, but you have to officially be registered for only one of them. Application is really easy. You just apply through our application portal. So as you're completing the supplemental application for the College of Medicine, there's the option to complete the SCP application as well. And the deadline for those applications isn't until March 1st. So you can go ahead and submit your application and then come back to the application portal to submit the application for any of the SCPs, and then come back and add another one. So for example, let's say if you've already submitted your supplemental to us, and after tonight you realize that there's an additional program that you wish to apply to, you can always go back to the program and resubmit the second application. I'm going to be very brief in this piece because I really want you to hear from the program directors, the experts who run the programs for us. But as Bridget mentioned earlier, we are featuring 3 of our programs tonight. So the first one is our Clinician Executive Medicine program, which is available to all of our students on all of our campuses. The other program that we'll be featuring tonight is our Innovation Medicine program, the IMed program, and that's for those of you that are tinkerers and have to be really creative in healthcare delivery models, available to our students on the Chicago campus. Dr. Kochi will be here to speak with you about that program. And then finally, our Urban Medicine program, which is also only on the Chicago campus. It is our oldest running scholarly concentration program and the largest one. And without further ado, I will hand it over to Dr. Noreen to introduce you to the Clinician Executive Medicine program.
Thank you very much and welcome everybody. I am Jay Noreen. I'm a member of the faculty in internal medicine and associate dean, and I direct the CE Med program. And we have a couple of students from the program who might be available to respond to your questions and give you their insights. And Niraj Chawla and Sebastian Diakis, who are M4s, who are in their 4th year and have been in the program for the past 4 years. So with that, I will share my screen and give you a kind of an overview of the program. Again, it's called Clinician Executive Medicine program. It is a program that occurs all 4 years, as do the other programs. Again, please be free to ask questions at the end of our session, if you have any. The curriculum is again, a 4-year program, longitudinal. All 4 of the years work together. So you're not separated by year, and 1, 2, 3, and 4 are all in the same sessions. And its basic focus is development of clinician executive leadership skills and related knowledge. And so the overall goal is to provide students the insights into effectiveness as clinician leaders in healthcare delivery organizations. The enrollment is through a selective competitive process, as Dr. Mary said. We admit between 15 and 20 students each year, but it is on all 3 campuses. And so when we have sessions, all 3 campuses are participating. These are essentially the topics of principal focus for the program: health policy and politics, decision analysis as it relates not to just clinical decision-making, but strategic and leadership decision-making in healthcare organizations. And of course, marketing from the point of view of a physician's perspective, medical ethics, the legal issues that are dealt with as physicians, of course, the finances of healthcare, and the economics of healthcare, and quality, a very important element, and overall strategic planning. The methods we use, we have monthly seminars. Again, all 4 years are participating at the same time in the seminars. And each seminar as well includes a series of readings related to that particular topic. And a very important part of the program is every student has a mentor who is a clinician executive in the College of Medicine and in associated healthcare delivery organizations. And that is an individual one-on-one mentorship. We have a special commitment for our students, our CE Med students, in the summer between the M1 and M2 year. We call it a clinician executive immersion experience. And in essence, it's spending time with one or maybe more than one clinician executive in our healthcare system in medical school, and spending time sort of observing what the role that they play is, and spending time with them one-on-one to better understand those roles. And very important part of the program is what we call the special project. Each student develops a project and particularly thinks about it during M1, but in that summer immersion develops in considerably more detail a project which they will continue to work on for the remaining 3 years. And it's a project of relevance to healthcare organization delivery quality and the relevance of the clinician in that activity. And then there is the option to audit some of the health administration courses that are existent on the campus. The mentors meet approximately monthly. Students meet with their mentors approximately monthly. And it's really, again, one-on-one. And many mentors are very willing and able to meet with you more often if you have good reason to do so. The other thing that the mentors help with is planning that summer immersion. The summer immersion is a quite significant time commitment, and the mentors will help connect you with either their activities in leadership or with other colleagues who are executives in the healthcare system. They also are a major resource for providing you with advice and guidance on development of and continuing oversight of and advice on your special project, again, which is a 4-year committed activity. Now, some examples of the clinician executive mentors who have been available to students. You can see the list, but most importantly, you can see the roles that they play. Dr. Bland is part of the Joint Commission on Healthcare Accreditation, Chief Medical Officer at one of the major affiliate clinical organizations, healthcare organizations, the Associate Head of Pediatrics, the Head of Internal Medicine, an Assistant Dean for Graduate Medical Education, President of another one of our major healthcare organizations, Vice Head of the Department of Internal Medicine and Cardiology, Head of Cardiology, the Chief of Psychiatry, the Vice President for Medical Services. And these are just examples. There is a mentor for every student. So we have about 60 mentors throughout the College of Medicine. So this is a bit of information on what we call the Summer Immersion Program. It's essentially about 90 hours of time spent with your clinician executive mentor and or others. Now, the summer is flexible. So this is something that the CEMED student works out with their mentor as to whether this will be 3 weeks of intense time for 90 hours, or if it'll be divided throughout the entire summer. And of course, depends on both your mentor and whatever you have scheduled during that M1, M2 summer. But it's highly flexible in that regard, but it is the equivalent of 90 hours of shadowing. So those are the kinds of options. There's quite a range of flexibility in that regard. The special projects, again, they are addressed in all 4 years. And they are, in essence, some important current or future operational challenge of healthcare delivery organizations. It's an opportunity to really delve into what are some of the ongoing and frequent challenges of healthcare delivery. Again, with much advice from your mentor and oftentimes several other faculty. Now, it is possible to pursue your special project in small teams, and students do it either way. Most students do it individually, but many students team up with another colleague or 2 other colleagues. And the 2 students who are with us today have done a partnership and have worked together on this for all 4 years, so they can talk to you about how the partnerships work. And then the final product of your CEMED experience is what we call the CEMED Showcase, which happens in the spring of your 4th year. And it's then that you share your special project experience with all of your colleague students, M1 through M4, and of course with your mentors present and with other faculty who have been involved. So it's a final presentation, also a report, but the main goal and the main objective is for you to share the experience with all of your fellow CEMED students. So one of the principal objective is to share that experience. That's more the importance of the presentation than it is our evaluating your presentation. The students do a wonderful job. We're not too much concerned about evaluation. We are interested in making sure all students benefit from all other students' experience for those 4 years. Here are some examples of the special projects that the CEMED students have addressed. Post-acute care transitions in clinical access hospitals. Looking at pediatrics, and this was what a student did in share with their mentor as Vice Chair of Pediatrics, market share analysis, involvement in development of neurological devices, in this case with people in the Department of Neurosurgery. The use of EPIC, which is the computerized medical record. For those of you who may not be aware of that, this has been implemented all over the country, and at the University of Illinois Hospital, this has been implemented over the past 2 to 3 years. And the students who are with us today, Niraj Chawla and Sebastian Giacchis, have been the students who have surveyed primary care physicians at the College of Medicine on their response and the issues related to implementing this highly complex and sophisticated computerized medical record. Students in one of the campuses have been engaged in evaluating vaccination rates in their county health department. It's very interesting. They started that project before COVID hit. So you can just imagine how complicated their project became. And this was a team of 3. How complicated their project became after COVID hit. So they were right in the middle of the storm. Street medicine in Chicago. There is a group of students and residents involved in providing services to underserved populations on the streets of Chicago. And one of the CEMED students has been a key partner in that activity. And then, not surprisingly, students have been engaged in looking at inequities that have emerged during the COVID pandemic. So these are, again, examples. There are about 45 of these in operation, and there'll be another 15 or 20 that come online with the new M1 students. So there are many others as well. So these are simply examples. But this is basically the bottom line. The overall goal of the CE Med program is, in fact, to develop, as you see on the slide, future clinician executives. Graduation from medical school and residency obviously is focused on clinical performance. But one thing that, that students and residents experience is all of the complexity of the healthcare system in which they are operating. And the CE Med program is intended to give you insights even before you begin to be heavily involved in the delivery of clinical services, and to offer you the opportunity to think about a career in which you take on a role as an operating clinician, but also as a leader in the healthcare system, providing that interface between the administrative side of the organization and the clinical side of the organization, which is a very complex interface requiring sophisticated leadership. So we're looking to the CE Med students to become the clinician leaders in the future healthcare system. So with that, I will stop, and we will come back, of course, to questions at the end. And both Neeraj and Sebastian will be available to provide some insights as well. So I will turn it back.
Thank you so much, Dr. Noreen. And if you want, we can bring your students on. We have about 10 more minutes, unless you'd like to save them for the end panel.
Yes, Neeraj and Sebastian, would you like to come up and just provide whatever thoughts you'd like about the experience you've had?
Sure, I can go first.
Neeraj is on his surgery rotation right now, I think.
Yes, I'm on my ophthalmology rotation right now.
Ophthalmology, okay.
Yes. Hey everyone, thanks for joining. So Dr. Noreen gave a really good summary of the CE Med program. And, you know, I think I just want to let you guys all know that, you know, it's first of all, these programs are not mandatory. That was a little point of confusion for me at the start as well. So you don't have to do these programs to enroll in the College of Medicine, but they are really good experiences because one thing you learn in medical school is that you learn medicine and like a lot of like scientific concepts and stuff like that, but not healthcare necessarily, which is the actual practice of medicine. And you know, there's a lot of complexities in delivering healthcare beyond just knowing your scientific content. And I feel like these experiences really give a good insight into that, and, you know, just help keep perspective on that. So the reason I applied for the CE Med program was because I didn't really have much of a public health background, and it was something I was interested in immersing myself in. And it was still the second year of CE Med, so it is like relatively young as a program, but it has really taken a lot of strides since then and really refined. Everybody's very welcoming. It's a strong sense of camaraderie within the program. You know, these monthly meetings were very useful, the readings, we have good open discussions. You know, it doesn't matter how strong of a background you have regarding these sort of topics like health literacy, health equity, ethics, but it really helps instill important values and like an understanding of why like a multidisciplinary approach to tackling problems in healthcare that extends beyond the physician is really key, and what we can do to sort of work towards that quality improvement. So that was the main reason I joined CE Med. I wanted to sort of use those experiences as an M1, like the meetings, to really understand what we're all about before I decided on my project. And it just sort of happened that Sebastian, who's the other student here, was like, you know, we got along pretty well from the start, and we wanted to we wanted to do a project together just because we were in a similar wavelength. And at that time, you know, Epic, the electronic health record, was being implemented at our hospital. It was still in the works. So we thought it would be a perfect opportunity to explore the healthcare delivery, because a lot of these, we wanted to see what the physician's perspective of the actual training and implementation was, because it's such a long-term process. And we really did not find too much on that. So, you know, through this program, we've been able to like identify a key knowledge gap and from there, like directly address it. You know, our survey went through multiple edits, and we had like a series of surveys, and we had multiple people in the field sort of assessed them and we refined it, and we also changed it as the COVID pandemic hit to adjust the survey accordingly, because the EMR was also adjusted as a result of it. So we learned about adaptability. You learn about how to like design your own project, which is, like your mentors there on the side, they're not telling you what to do. They're giving you advice, but ultimately you are in charge. And that's really good, because then you can personalize the project and you can really back it up and know about it more than anything else. We're still working on our project. We've collected our survey data. We've had a lot of people respond, which is fantastic. So, it's making good progress. I think everybody in the CMED program is honestly spectacular. I only have good things to say about it. Everybody's super supportive. If you have important clinical duties, they will accommodate for that. I only have positive things to say about it. So, that's my spiel on it.
Thanks, Niraj. And I will just mention that Niraj and Sebastian had the benefit of the head of cardiology and family medicine as their wonderful mentors as well. Sebastian, other comments?
Yeah, that was really well said, Niraj. Like sort of similarly, I think we gel pretty well, him and I, because I came in sort of with the same mindset. I really didn't have any background in public health or in any sort of healthcare administration. And I always thought that it was sort of like a bigger piece. You always hear about clinicians being frustrated with the system, and I kind of wanted to understand it and understand how it works and what is actually going on. And this is like the perfect opportunity. Dr. Noreen and all the other administrators and physicians really have done a good job of sort of giving us piecemeal sort of how things are going, especially like your first year, you do all the different presentations and you get to formulate your own project. And it really is whatever you make of it, which I love about it. It's what you put in is what you get out. And I think that it can go a long way. You get the opportunity to sit in on really important meetings in the hospital system, how they allocate resources, how they reach the community that they want to reach, how they deal with all sorts of things that people don't only think about in the healthcare system, that I thought was really interesting. And like Niraj was saying, at the time Epic was being implemented, we were using a different healthcare system before for like EMR, electronic medical record usage. And we thought it was a perfect project. And they really give you all the different resources to figure it out, to attack it the way you want to learn how to do the research, to learn how to sort of investigate what you're interested in any way you want to, really. Sort of similarly to what Niraj was saying, I think it really is something that I am glad that I jumped into. I love all the other students. There is a huge camaraderie. And yeah, the tools that I've learned through this have been they've been invaluable in terms of how I go about my own training. I'm currently in my psychiatry sub-internship right now, dealing with all the different other pieces that are involved in medicine have sort of helped me, I think, get better care as well.
Right.
And I think that's something that's invaluable. And I've learned a lot more how to do the research and stuff. So it's been perfect for me.
Great. Thanks very much, Niraj and Sebastian. Much appreciated. And I will just add one other thing, and that is that it is a lot of fun to hear the presentations from all the students and the developments over the course of the 4 years. And I'll have to tell you that the mentors really enjoyed it a lot as well. So it's a shared experience. So I think we'll end it there and turn it back to Dr. Amirian. Thanks again, Sebastian and Niraj, for coming.
For introducing the next panelist, which is Dr. Kochi, who'll be talking about the IMED program.
Hi there, good afternoon, everyone. Let me see if I can share my screen. For giving me the opportunity to talk a little bit about the IMED program, our Innovation Medicine program. I'm Midi Kochi. I'm the director of the program, and I'm faculty in the Biomedical Engineering Department, which is jointly housed in the College of Medicine as well as the College of Engineering. I have the slide that you're seeing right now is introducing our core faculty. You'll see that we're a pretty interdisciplinary program, and we have a couple of engineering faculty as well as some core physician faculty. These are our core faculty, but similar to the CE Med program, in our other concentration programs, we lean heavily on many of our clinical faculty to support the program across the College of Medicine as well. So what is IMED? The IMED program, I think about this as providing some opportunity to introduce a systematic approach to innovation in clinical practice and in healthcare delivery, specifically focused on medical product design, although the last couple of years we've been doing a lot more digital as well as process innovation as well. We are interested in creating physician innovators who are experienced in identifying and validating true clinical needs that can be addressed through technology, and brainstorming concept ideas to develop novel solutions. And the program is a hands-on type of program where we ask students and our participants to practice the tools that they're provided in real-world scenarios to move from problem identification to, we say viable product, but that's the ultimate end goal. So we're not actually expecting anyone to commercialize any products, but we're looking at where are there some market opportunities and where are those pain points that can be addressed. Similar to the other concentration programs, IMED is a longitudinal elective, and that means that we provide 6 weeks of elective credit over the 4 years of medical school. And again, we focus on identifying and validating clinical needs and developing solutions to those. And I'll talk a little bit more about that. So the primary emphasis of our program is really on observation and interviewing. So I'm coming from an engineering background, and one of the challenges that we're always faced with is, yes, we're trained to develop solutions, but we need the clinicians to help us identify where their actual problems that need to be addressed are. So we talk a lot about and practice a lot of observing processes and looking for workarounds, looking for opportunities, provide training in actual interviewing and understanding where there's themes coming up and where we can see where those pain points are. We look at validating these clinical needs, and then we talk through the product development process. Again, we're not looking to create. We're not asking our IMED students to, become engineers, although I will. And there's no requirement to have an engineering background, but we do have quite a few students that kind of self-select, I think, that have an interest in innovation medicine, that have technical backgrounds. It is not a requirement at all. But one of our goals of the program is really to introduce our medical students to all the different stakeholders who are involved in product development, so that our IMED students understand what the business stakeholder, what they're looking for when they're looking at a market opportunity. What does the development engineer, what are they looking for when they're talking about what's feasible to create? And then giving some opportunity to practice translational research. I've kind of lumped the whole 4 years into one slide, so my apologies that this is going to be very dense in content, but in a nutshell, I have our 4-year program kind of in a graphic. We kick off, we have a fall all program event usually in the fall. We have a first year orientation meeting where everyone gets a chance to get to know one another and kind of build that cohort. And then we have our first year course, and I think of this as our foundation for the program. It's a 2-semester course, and it's roughly every other week. And it is a class where we introduce the process of medtech innovation. And it's a class that is for 2 semesters, and in the spring, we bring in biomedical engineering master's students to support the program. And I'll talk a little bit more about that in the next slide. Similar to the CE med program, we have a summer opportunity between M1 and M2 year for a clinical observation program. This is an opportunity for students to kind of practice what they've learned in their first year in the MedTech Innovation class, and they have a chance to spend some time in a few different clinical environments. We've worked with, I think, 15 different medical departments over the last several years. We put our IMED students in, and they have a chance to spend some time in the clinical environment, not with the eyes of a future physician practitioner, but really asking students to spend some time looking or spending this time with the lens of identifying potential problems. So perhaps they'll observe some surgeries and watch from a perspective of process flow, what equipment is being used, how many people are using it, how are people flowing through the room, how is the equipment being used. So really looking at that time in the clinical environment with a different kind of lens than a typical medical rotation. Our second year then is spent we offer a couple of technical workshops and some lunch seminars. The lunch seminars, we bring in a wide variety of speakers, and these are physician innovators themselves. We bring in some folks to talk about patent law and how that applies to medical students and also to physicians in the workplace. We bring in some speakers from the local Chicagoland MedTech community, particularly from Matter Healthcare, which is an incubator here in downtown Chicago that serves as an accelerator for maybe 300 startup MedTech companies that our students get involved with. And over the last several years, we've begun offering a couple of technical workshops. So these are some really basic Arduino, which is some microprocessor workshops to play a little bit with some technology, not required. And to be perfectly honest, this came from the students. The students wanted to get a little bit more hands-on so that they could create their own prototypes. So don't be afraid if you're thinking like, oh gosh, why are there these technical requirements? They're kind of optional, but students really enjoy them. And then similar to that, this actually also came out of a request from students, is there's an optional prototyping class. This is offered generally to M2 students. It's an optional evening class, and IMED students came to us and asked, could they get a little more experience in practicing doing some 3D printing, working with some basic machining equipment. And so just as an optional opportunity, we work with the College of Engineering's Makerspace and created an IMED only kind of prototyping experience. It's very accessible. It's a 6-week, 1 hour a week program just to try out some prototyping equipment. And then that really kind of springboards us into our capstone projects. So as we go into our first and second years, we're really starting to talk to students. We're building the foundation and talking to them about developing a capstone project. The IMED's capstone projects are team-based, and so students are expected to come up with potential projects that they can work on with other IMED students. And we have a weekly lab that one of our faculty runs. That's just a place for all of our IMED students who are working on capstone projects to kind of come together, to get resources, to get support, and a place to kind of develop their capstone project and get feedback from faculty and their mentors. And then as we move into the third and fourth year of the program, really, of course, our students are busy on their clinical rotations. We ask them not to forget their capstone projects, and so they are working on their capstone projects concurrently, and twice a semester at midterm and finals of each semester during M3 and M4 year. They do a progress presentation to the IMED program and faculty and get feedback and then do a final presentation at the end of their M4 year. And then, of course, graduation. I'm going to talk a little bit about that first year class because, again, as I mentioned, I think about this as kind of the foundation, really. It's, again, a 2-semester course. It's held at the UIC Innovation Center, which is a really cool space that is not owned by any particular college or at any academic unit at the university. So it's kind of this neutral space that lots of people come together and collaborate together on various types of projects. They're very heavy, work a lot with the College of Medicine. So we do a lot of IMED programming at the Innovation Center. I mentioned that this class is approximately every other week on Tuesday evenings. And the thrust of the class is really to work through on team-based projects and learn that process of problem identification and validation. And then, as I had mentioned earlier, in the spring, we bring in engineering grad students, and they are really eager to be part of this class, one, to get some interdisciplinary experience, but also to help support prototyping any solutions that the IMED students are developing that first semester in the fall. We heavily lean on the biodesign process that comes and the biodesign text that comes out of Stanford University and Paul Yock and his collaborators. This is kind of, the biodesign is kind of the, I don't want to say the Bible, but it's the primary, I think, process that has been collated as far as medtech innovation. So we focus on the IMED program focuses pretty heavily on the first two components of the biodesign process, and that is, as I've mentioned, this needs finding and needs screening or validating. Is this actually a problem worth solving? And then developing concepts, potential solutions, and making sure that the best solution is the one that we go forward and develop. My last slide is really why IMED, and just as a summary, really we think of the IMED program as providing tools to become a physician innovator. We want students, and I think a big piece of my work with the program is to create opportunities for our students to network and to interact with as many other future physician innovators and current physician innovating faculty as possible so they can grow their networks. There's also a lot of opportunity to develop intellectual property. It's not a requirement, but a lot of our capstone projects, students and teams will file with the university tech transfer office to protect that idea. And so we've had some patents that have come out of it in collaboration with their faculty mentors, which is pretty exciting. This past year, we had two patents come being processed, one of them on a novel tear collection device. This was a capstone project that some students had worked on with some engineering students during that summer program, and then the IMED students continue that project on. Another example of a project that ended up having a patent be part of that was a novel way of suturing spinal cord incisions during durotomies. And so there was a really innovative way to go about that as opposed to the standard needle and thread, so to speak. And so they were able to protect that through the university as well. So there's opportunities on that front. And then similar to all of our scholarly concentration programs is, I think these programs are a great opportunity for students to differentiate themselves and really get a little bit deeper and dig a little bit deeper into their interests that complements their core medical school education. So they're particularly competitive for residencies Whenever I do exit interviews with our students, they always tell me that a big piece of their residency interviews are talking about their IMED involvement, their IMED projects and the experiences that they've gained. So, so that is IMED in a nutshell. I look forward to talking to you a little bit further and answering any questions that you might have at the end of our presentation. Shall I turn that back over to Dr. Amiri? Here.
Sure, thank you so much, Dr. Kochi. And we have our final presentation from Dr. Michael, who's a part of our UMED program.
Thank you, everybody. Good afternoon, evening. Thank you for joining us. I'm so excited to share the UMED program with you as prospective applicants. I am the director of the Urban Medicine program, and I will, let's see if I can get right into it. So UMED is, as Dr. Amiri mentioned, the oldest scholarly concentration program. We began in 2005 with a mission to train a workforce of physician leaders who are committed to partnering with local organizations in Chicago to address health disparities by promoting justice in systemically oppressed communities through collaboration and advocacy. So a lot different from some of the other scholarly concentration programs this evening. Our focus is very much community directed and community minded, even though all of our programs engage in the community in some way. Our vision is to create a workforce of physicians that reflect the socioeconomic diversity and racial makeup of the United States, that build partnerships of mutual trust and understanding to support the communities that we live and engage in, to uphold a culture of accountability towards patient advocacy and health justice within the medical profession, to respond to calls for action and advocacy on behalf of and in partnership with our patients and our communities, to promote health equity through a transformational practice of medicine that includes public health that is founded in social justice, and work to dismantle interlocking systems of oppression, such as white supremacy, structural racism, sexism, homophobia, the profit motive in healthcare, massive incarceration, and I'm sorry, my screen won't show the rest. My apologies. I'm going to move to the next slide. So our goals are to graduate physicians that regardless of specialty, right? So whatever specialty you want to go into, we believe that UMED is relevant and will make you help support you in becoming a better physician. We want physicians that are equipped with knowledge, skills, and attitudes to fulfill the role of a culturally sensitive practitioner, particularly in vulnerable and oppressed communities, to be a community advocate for change, to be a community-based researcher, working with and in collaboration with communities to make population health better, and to engage in policy and advocacy to become change makers at the systems level. A big foundation, kind of the centerpiece of our work, is really grounded in community and because of the community partnerships that we have. Most of our partnerships we've had for about 10 years. And they are longitudinal in nature, and they focus on a population health service project. They are community informed, so we have a community advisor at each of our 6 sites, and that helps inform us and ground us in the real needs of the community. The project starts in the summer of M1, so if you were accepted into UMED, or I should say when you're accepted into UMED, you will get a list of the community partners and the students that are there, and you'll begin that communication online to identify the projects that have a focus that you're most interested in. And then, as I mentioned, the project proceeds through all 4 years and becomes sustainable because as the M2 students move into their step 1 preparation, we have a group of M1s that are going to take over their projects. So there's a beautiful line of mentorship that happens between all 4 cohorts because once you're aligned to your site project with 2 other students, you are with that project for the remainder of your time with UMED. And we really strongly believe that changing community involves building relationships, and that the building relationships requires trust. And trust requires staying in the community for a while, showing your face and letting them know that you're really there and that you really care. These are our projects. I'm not going to go through them in detail, but they are at several different neighborhoods. Those not familiar with Chicago, we are known as one of the most segregated neighborhood cities in the nation. That has both beautiful elements to it in terms of cultural preservation and support, but also elements of segregation that are not so favorable. But we work in a lot of the west and south sides of Chicago where disinvestment is more common. And these are our different focuses, from anything from food security to supporting youth that want to become doctors, dentists, health professionals in any form, as well as a more recent project with our own UIC Office of Community Engagement that involves incorporating men when we think about families' growth throughout the continuum, and also addressing male depression, specifically among Black males. So we have a variety of different projects to get engaged in, and these are based on partnerships that our program has cultivated over the years. Our curriculum, like the other scholarly concentration programs, has 6 credits that you gain over all 4 years applied in the 3rd or 4th year. This is the breakdown. The first 2 years are a lot of workshopping in together around 2 hours. They are planned around your exam schedule and everything else. So we are sensitive to, we want you above and beyond to have MD at the end of your name, but we want to support these other elements in your development. And in the third year, when you are mostly on clinical rotation, we have an online course that gets you ramped up to identify systems level issues related to the population project you've worked on in the first 2 years that can really bring more system level change. And in the 4th year, we bring your cohort back together for a full week of engaging dialogue with politicians and change makers, community organizers, to learn how to really collaborate collectively with community to bring change in the sphere of course, of healthcare first and foremost, but we believe that healthcare and public health is very, very broad. And if you don't have appropriate housing or food to eat or whatever the case may be, especially in these COVID times, then, you know, healthcare is obviously compromised. And then this is just a little schematic. I'm not going to go through this in detail, but it gives you a sense of how we start the year. One of our most favorite events is the bus tour. When the M1s come in, we do a bus tour around the city. We're planning for that just next weekend. We visit all of our community sites. The students get to see where they will be placed. And the goal is to be on site in the homeless shelter or in North Lauderdale, wherever the case may be, to really be engaging with community and providing them majority health education. Now, obviously not clinical because they're still medical students, but listening and to the needs of the community and then responding with health information. And then through the mentorship process, we transition the project to M1s as the M2s move into their clinical rotations. And then, as I mentioned before, come back together for a summative project. There is a paper due at the end. These are group projects. So again, all 4 years in the same community with the same 3 students, but you have mentorship from the other M2s through M4s as M1s and so forth. These are our other UIC collaborators. One of our partnerships is with the Office of Community Engagement and Neighborhood Health Partnerships. Director Angela Ellison also provides seminars on that. We have Audrey Stillerman, who is an integrative family physician and also runs the Center for a Center for Trauma-Informed Care. She runs the trauma-informed care sessions. Shika John is in also our at UIC, and she helps us with the teaching students how to write op-eds and being really engaged in the social media platform to create change, and individuals in the School of Public Health as well that help us bring in the public health content. These are just some outcomes. If you're wondering, our students do everything and go everywhere successfully, and they are change makers. So this is just the variety of surgical specialties, and this is data from 2009 through 2020. Again, the different medical specialties across the board, And we do predominate in students that want to go into primary care and have potentially a more longitudinal relationship with their community and their patients. And so this is the distribution of our students over time and the specialties that they go into. But of course, because we're building physician leaders and change makers, this is not all that they do. And I just want to share that this is a little bit of some of what our students have done. The top left is some of our current M4s that with a project we had with the UIC Sickle Cell Center identified that children didn't have a specialized education plan if they had sickle cell, and that teachers and students alike did not know what sickle cell disease was or the implications of how it affects their education. And then, so these students took their project straight to the AMA and got a unanimous approval for a sickle cell resolution to educate, train, and prepare schools to identify the many diverse complications of sickle cell disease. We also have on the top right, we've had a lot of publications from our students working with the Young Doctors Club in North Lawndale, creating new leaders that believe in themselves and are going to be change makers in the future. On the bottom left, we have one of our students did published something from the Deborah's Place Partnership, where she worked with the homeless women, and the homeless women told her stories of, I'm sorry, I shouldn't refer to them as that. The women with unsecure housing at the time told them about some of the recipes that they really loved that they knew weren't healthy. And so she adapted it to a DASH diet, which is helpful for those with hypertension, and published the book, and all the proceeds go to the women in the shelter. And we have also on the right is Dr. Rachel Bearville, who is in residency, and she not only has presented in front of the AMA, but started her own organization to help Black women in the areas of maternal and child health disparities. As we know, Black women have terrible disparities when it comes to maternal and child health outcomes, and this is her passion, and so she's built an organization around it. So both individual and collective work with our partnerships and beyond to really be change makers in medicine. I want to go back one and say, why should you apply to UMed? And I think this applies to a lot of the programs that you've heard today. It is a specialized training program that stands out in residency applications. As Dr. Kochi mentioned, our students time and time again say that this was the focal point of residency interviews. It stood out, they really wanted to know more, and believe me, you'll have plenty of stories to tell. It prepares you to approach clinical practice in a new way from UMed perspective, from a public health perspective, and also responding and reacting to the primary needs at the community level. It also supports professional development and clinical skills. So through our work in the population, in our different organizations and in our different communities, it helps you understand how you can build patient trust through building relationships. It helps you identify, provide tools to do community needs assessments, asset mapping, and different approaches in public health so that you can find out what your resources are, what your assets are, who you can refer your patients to, beyond what your services can provide, as well as being able to connect and create companionship within the community that you're going to provide clinical practice. To conduct community-based research, what does that mean? How do you know it's working? We also provide scholarship and internship opportunities. Many of our students go on during med school to become Schweitzer Fellows, which is another very, very highly regarded thing to add on your CV, another service-based project in Chicago. We also have internship opportunities with other organizations and physician groups that are doing advocacy and coalition building. These are additional if you have the time, but it allows UMed students that are interested in one of our varied topics to take a deeper dive with more mentorship, and that sometimes happens over the summer or throughout the year, and it just enhances and allows you to go deeper. It also helps you build alliances and advocate for vulnerable and oppressed populations through tools that we use, sometimes in the space of community organizing, sometimes in the scholarship space, but in order to understand how do you build alliances and build coalitions to really bring a larger level change to your community. And I say above and beyond, and I have Kate Galvin here, who's going to be a representative or speak on behalf of her experience with UMed. I'm so grateful to have her here. She can speak a little bit to a lot of what the students always say is that it fosters a community of like-minded individuals. So the Chicago campus is very large, close to 200 students. And so to find 18 students every year, which is our acceptance, our incoming cohorts, that really are committed to this is incredible and creates a support system that I think above and beyond all of the academic content, I think it creates a lifelong bond and network, and we all need that support. And of course, we make a positive impact on Chicago communities, which I'm a native to Chicago. I love Chicago. I love Chicago communities, and just to have an opportunity to build relationships in our diverse community is really a privilege and an honor. And to be able to make change too, of course, is what all of us service-minded individuals want to achieve. The ideal UMed applicant for us is someone that is committed to service. So in your application, we look at your service, particularly those commitments that you've had over a long term, because it shows us that you really have a passion for that community, that you're really willing to engage throughout the continuum and be there for them, whatever community you define in a very broad sense. An individual that demonstrates a passion for addressing health disparities, that the individual may have completed classwork in related topics such as public health, anthropology, social work, things that relate to population health and community health issues, although not required, but obviously it enhances your application and shows your commitment. A lived experience with vulnerable populations. We obviously are looking for a diverse group of students. And so those that have their own personal experience obviously enhances our conversations, which we have a lot of in the classroom, and enhances all of our learning and understanding. Knowledge of another language. Some of our projects are delivered in Spanish. And obviously also it shows an interest in a population other than your own, which enhances your application as well. A willingness to reflect your own privilege and positionality. We start the year by understanding we all have privilege in one way or another, whatever that means. And you will be, as someone wearing a white coat, that gives you privilege. And so we want to be able to deep dive into that and be able to be vulnerable. And someone that has a willingness and desire to engage in difficult conversations around sometimes controversial topics, but ones that really, in the end, will bring, we hope, a society that's more equal and diverse. So I'm going to turn it over to my wonderful student to provide her own bit of testimony to her experience in UMed.
Hi, everyone. Good afternoon. My name is Kate, as Dr. Michael mentioned. I'm currently a fourth-year medical student at the University of Illinois at Chicago. A little bit about my background prior to applying to medical school, which I think supplemented a lot of my UMed application in addition to my UMed experience. So I actually did all of my schooling in Chicago. I went to DePaul University, where I received a bachelor's degree in chemistry. So I actually didn't come from a public health background. So the UMed lectures and the community health and population health discussions have really supplemented overall my medical school educational experience, I would say. Prior to applying to UMed, I definitely did identify a population that I wanted to work in. So I was originally born in the Philippines, and from that immigrant experience, I saw a lot of disparities within my own community and my family. So in addition to, or despite not having public health experience, I felt like I had a lot of lived experience within this community in addition to volunteer and service. So I would say that UMed overall had really strengthened my understanding of social justice and population health, in addition to, giving me a way to do medicine that wasn't necessarily strictly medicine in the strictly like biological sense. It definitely gave me a perspective. I would say that in preparation for the clinical years, that I was looking at patients through a social justice lens and not necessarily just, like the biomedical lens. And I would say it supplemented my understanding of my patients' experiences and also, you know, how I can help them as a medical student. Because sometimes, you know, you're not the most experienced person on the team, but you can be there for your patients. And I would say that, you know, strengthened kind of my evaluations during clinical years, so that, you know, residents and other faculty like notice that work that I put in and that extra mindfulness around my patients' like social experience. I don't think I have anything else to add. I'd be happy to stay to answer any more questions for any particular applicants, to be able to share more of my journey and experiences and answer any questions that you may have for me.
Thank you so much. I'm going to ask all of our panelists to unmute their videos. I have a lot of questions from our audience, which is really exciting because it shows that you have a really great interest in the program, and even some probably from current applicants. So if you have a question, go ahead and drop it in the Q&A feature. You probably saw that we're planning to answer several of these live, and that's what we're going to be looking at. So if you accidentally dropped it in the chat, go ahead and put it in the Q&A. Now, if you have to leave early, or if you think your question is really particular to yourself, go ahead. I'm going to have our panelists drop either their email or their program's email in the chat feature so that you can email them directly. Okay.
Bridget, if you would open my video, that would be great.
Oh, sure. Let me invite you to share your video here. Okay. All right, let me take a look here. Okay, so our first question actually is for you, Dr. Noreen.
Yes.
When you picture the CE Med medical students of tomorrow, maybe the entering class of 2022, what do you envision?
Really an interest in leadership and experience in leadership. Those are the main characteristics, but predominantly interest in leadership.
Great. We have an IMED question. If we have previous involvements in medical innovation, are we able to continue pursuing those through the IMED program?
Absolutely. Yeah, we have some students that come in and they've been working on a project, either they as undergrads, or maybe they took a pause between their education and it's something that they've been working on their own. We're happy to help them continue those projects as well.
Great. Now, we had a lot of questions just about the application process. Dr. Murray, if you could summarize as best you can a lot of the questions that came in.
Sure. Thank you so much, Bridget. We thought we'd just take a minute or so just to revisit the application questions. There's a lot of them. So the application is housed with the supplemental application that we have for the College of Medicine. So when you receive the invitation to submit the supplemental, there will be a question, you know, are you interested in any of these scholarly concentration programs? You'll select the box and then the application itself will open. So it's another tab that you have to open. You can go back and submit it. So let's say you've submitted your supplemental already at this time. You can still access the secondary application portal just like you did originally when we invited you to complete your supplemental, and you can fill out the questions there. Submission of the SCP does not alter your place in the queue to be reviewed for admission to the College of Medicine. And each of our programs have a little bit of a different process in terms of how they review the application. So IMED reviews applications on a rolling basis, just as we do for admissions. So it's very possible that you'll be invited for interview for us, as well as for the IMED program. The CE Med program generally waits until the application deadline has passed, March 1st, and then they'll do bulk interviews. And I think the UMed program is going to experiment this year because of the high number of applications that they get, and they'll probably have 3 intervals while they'll review the applications and invite candidates to be admitted. One of the questions was, where are the programs located? So CE Med available to all students on all campuses, UMed and IMED restricted to the Chicago campus only. If you are assigned to a campus that isn't the campus where your program is housed, we will we'll move you to that program. You can apply to as many of the programs as you wish, and at the end you'll select one that is most compatible with what you wish to do, and then that'll be the program. I think that was all of the admissions type questions that we had, Bridget. I'll keep an eye out for them as well if more pop up.
Great, wonderful. Thank you, Dr. Murray. Getting to more program-specific questions, we have a question for UMed. How is urban health different from community health or population health?
How is urban health different from community health or population health?
Mm-hmm.
I wouldn't say it's different. It's just if you look at it's kind of a subset, a sub area of focus. Kate, I don't know if you want to share something. I think with your experience in Chicago, you may have a lot to share too, but I would just say that that I think the experiences are similar, but our focus is Chicago and our neighborhoods so that we can try to maximize the work we can do while we're involved in the program.
Yeah, I agree with that definition, Dr. Michael. I think there's a lot of similarities and intersection between community health, population health, and urban medicine. Obviously, we are in an urban area, so that's where a lot of our experiences are. But I mean, from some of our seminars, I know we've also discussed like rural health, health disparities in other contexts. So not necessarily just urban. That is helpful.
Yes, that is helpful. We have a question for CE Med now. What are some career paths taken by students in the healthcare executive track?
Well, it's a little early to say. The program is in its 5th year, but based upon interest, I would expect that many of the students will find themselves in leadership roles after they finish their residency and join a group practice or a hospital. But yes, it says we have only prediction at this point in time, not actually real experience, because we're, again, it's in our 5th year. So we've only had one graduating class.
Great, we look forward to seeing where they head to next.
Yes.
And this one for the IMED program, do IMED students work with both clinician and industry sponsors for the capstone projects, or are they mostly internally guided by the College of Medicine and Engineering faculty?
The capstone projects, to date have been internally driven, but we have had sponsored. Our foundation class, our M1 class, has been sponsored by industry partners. Baxter Healthcare has been a partner. We've had Motorola. So our students have had opportunities to work with industry partners, but not on the capstones.
And we have another question for you, Med. You touched on this a little bit, Dr. Michael, but how do these community research projects, they're so varied, how do they get funded?
We do not have a sustainable structure of funding for the projects, and I thought that was going to be a barrier over the years. But people that are engaged in service and making change, we're going to get together and do it regardless. And so I will say that over the years we have had, I'm also the deputy director of the Area Health Education Center Pipeline, which is a pipeline to education support throughout Illinois. And that's allowed us to provide some small grant proposal opportunities for students. So in that way, we've allowed students to learn how to write a grant proposal and report on a grant. The students apply based on their community project. Those are only up to about $500, but it's amazing. Student, with a few gift cards and so forth, although definitely not sufficient to a retribution for all of the time and effort. It makes a difference. And so we've been able to implement that. And I think just part of it is an equal exchange of energy and time and commitment to really making change. And so we have some opportunities sprinkled throughout the college to support students in their community efforts. But we've been able to do a lot of it without very specific financial support over the past 15 years.
And we had some questions for the CE Med program right away. As soon as our participants here heard the word mentor, they wanted to know how mentors are elected. How do you match them or assign them to students?
Yes, the mentors are really volunteers, and we simply invite them. And our experience has been that mentors are very, very interested and very committed to working with the students individually. But it's really a matter of connecting with with the leadership throughout the College of Medicine and affiliated healthcare organizations. And they volunteer. It's really volunteer work.
Great. Another question for IMED. How does the IMED program differ from the MSTP program apart from the length? And they asked, is academic medicine a good option after IMED?
Let's see. Well, the MSTP program, which is the combined MD PhD program, is different. I would say that it's much more intensive, of course, and that is research oriented. Whereas I think of IMED as a little more applied. However, we do have students. We do have a student we piloted that's a combined MSTP/IMED student, and we're developing a capstone project that will kind of try to leverage both of her experiences so that it's kind of streamlined. But they are different as far as a PhD program being creating new knowledge, essentially.
Great. We have a UMed question. What is the process like for choosing a specific UMed project? Do students choose the project they're interested in, or are they assigned to it?
Yeah, so in the summer, once you've been admitted, we send out a list of all the sites and invite you to connect with the M2s and learn more about the project. And then we do the bus tour, which allows you to visit the site, see logistics, and if this feels like the right fit for you. And then we do what's called the Community Partner Networking event. And it's an evening where we invite all of our partnerships and our M2 students to have kind of a meet and greet. It ends up being kind of like a speed dating thing where folks meet the partner, and we have at the end of the evening, the students picked their top 4 choices, and the partners pick their top students. And then we do a behind the scenes match process, thinking about the students and the team that they'll create together based on their experience and the preferences of the partner. And we always try to give folks their first or second choice. And then the match is kind of like a reveal based on that. And we always encourage students, some people come in and have experience with a specific population, and that's wonderful, if we are able to align with that, but we also encourage students to go beyond their comfort level and maybe align with a partnership or a group that they're not familiar with and expand their experiences and learn more from a population that isn't as familiar to them. And then after the match, they're in those teams of 3 for the remainder of the 4 years.
We have a lot of questions, and Kate, since you're our only student representative here, there is a worry about being able to take advantage of all these opportunities, but what about balancing the extensive workload that comes from being a full-time medical student while also participating in one of these programs? Can you talk about how do you give adequate care and attention to all that you're involved in?
Yeah, that's a very great question. And that was definitely something that I was concerned about with applying or doing the UMed program. I know at the Chicago campus, there's other programs you can get involved in addition to these these programs specifically. So, it's similar to undergrad. It's a lot of time management and skills such as that. In addition to that, I think the preclinical year format of being pass-fail was definitely, I took advantage of that in the sense that I was able to pursue more, of my passions without necessarily giving up like a grade. If that, for example, I know, for example, the Young Doctors program, when I was still in M1, M2, I had to meet every Friday. So I know that was a big commitment for those students in that program. I ended up not choosing Young Doctors because, to be honest, that was a potential problem that I envisioned. So I think it just became a lot of what you're comfortable with and what you want to do with your own time during M1, M2 year.
Great.
And
I just wanted, oh yeah, go ahead, please.
Wanted to add that, students have we think about medicine as linear sometimes, and it's not. And people's pathway, there's a lot of events that happen, including marriage, family, leave of absence, all sorts of things. And I think I speak for all the programs in saying that we want you to succeed in medicine first, and that we are here to accommodate. So I've had students in their third year say, I'm on a surgery rotation. I know this is due at the end of the month. Can you give me, extension? Absolutely. We're here, to support you in your success. And, at the end of the day, the MD is the important thing. And so, we're flexible for folks. And because we're small programs, we can do that. And we can individualize things to make sure that you're successful and feel supported if things don't always go as planned, which they never do. So.
I would say that the important point is that the scholarly concentration programs are secondary to the primary curriculum. Always the primary curriculum takes priority. Now, in our experience, the students have been quite able to manage that, but there are times when a student is scheduled to make a presentation and they're on the pediatrics rotation and they're on call. And so we simply say, well, we'll do your presentation on a different day, no problem.
That's
I would also add, one last thing. At least for UMed, a lot of our sites are group projects. So you're not the only one doing all this work by yourself. I'm not sure if it's the same with other scholarly concentration programs, but you share the workload with your peers. And I think that speaks a lot to the community that these programs are fostering. Some of my closest friends from medical school came from UMed. So just being in that group of like-minded people, sometimes it doesn't seem like work, even though you are still doing work.
We have a question for all of you here. Are there medical specialties that especially benefit from your concentration? And Dr. Kochi, we can start with you.
Sure.
If there's one.
I don't think so. I mean, I think sometimes our students start out and they feel that way, that, maybe they're more inclined to a particular specialty, but where they end up going, it's extremely diverse. And I think it probably represents residencies across the general population of our graduating MDs. So
yeah, I would say the same thing. It is definitely not specialty specific.
Yeah, and I would say that all of these skills have a value in all specialties and professions. Our effort is to really spread that message out and that practice out, regardless of what our focus is. So I think there's an opportunity for all of that. And Kate, I don't know, you've got your fellow students that are choosing all sorts of things, right? I mean, I think our goal is not to be exclusive to one, but rather, changing the face of medicine means doing it across all specialties. And students, a lot of that is, our programs, again, we want you to succeed in medicine. We create a platform, we create an infrastructure, we create the beginnings, we plant the seeds, and it's really the student that takes it to the next level and takes it further based on their motivation. We are selecting obviously highly motivated students already. We're just creating a platform for them to grow and expand and find people, students like them that will be that support for them. So it really, I think, is up to the student of how far they want to take it and in what way in medical school and beyond.
We have a question for, Kate, if you would like to add before we go on to another question.
Yeah, I mean, I would just say, even though I am in the UMed program, I find myself being interested in all of these scholarly programs in some sort of way. I honestly, when I was in your guys' shoes, I was thinking about applying to all of them in some sort of capacity. I think I ended up choosing UMed because that was a thing that I was most passionate about and something that I had personally explored before going to medical school. So I mean, that was my ultimate decision. But I think, being in one program doesn't preclude you from doing a lot of other things, even not being in any of these programs. You can still pursue a lot of these things on your own. And I know people from my class and other classes who are, still doing community health stuff, still doing technology stuff, still doing all kinds of stuff, but it's just not formalized through a program.
Absolutely, it doesn't make exclusive access at all. We're just pointing you to the people maybe versus you having to find it on your own. So we might speed up the process, but absolutely, there's no reason why a lot of students that get into the college can't pursue a lot of these different areas.
That's such an important note. We have a question for CE Med. Are the projects for the Community Health Scholarly Project passed down from previous students?
No, they aren't passed down, but there's no prohibition against that. So it is certainly possible that if, as an M1, you begin to get interested in a project that maybe an M3 is doing, that you might join. There's no prohibition, whatever. But most students start their M1 project out of a specific interest they have and their relationship to their mentor. But at times they could, in fact, find a connection to an existing project, and that's certainly encouraged, but not required.
We touched on this a little bit in terms of time management, but in thinking about different curricular opportunities that UICOM offers, it's not just the scholarly concentration programs. We have a lot of joint degree programs too. How compatible are these programs, these scholarly concentration programs, with the MD, PhD curriculum, for example? Anyone wants to jump in?
Well, I would just make a comment, not so much the MD, PhD with regard to the CE Med program, but the MD, MPH has considerable potential overlap. So it's more a connection to that joint degree than to the MD, PhD.
Yeah, I would say I've known students who are in both programs, and it just also depends on when you take your time to do the requirements for the other program. So the PhD students take, I think, after the first year of medical school off to do their PhD, and then students in the MPH program, I think it ultimately depends on the student, but I know someone who's doing it in between third and fourth year.
Yeah, I would concur with Dr. Noren that we have had many students that do the MPH and the UMed program and the MD program. It is about, we try and encourage students to stay with their UMed cohort, even if they're off sync in other ways. And some of the UMed, their projects in the MPH have been built upon the relationships they cultivated in UMed in some way, or they bring the content. I mean, obviously, we're just touching on the topics of public health. We are in no way going to replace an MPH and the coursework. And so we touch on them, and then folks that go into it deeper can then circle back into their partnerships in UMed and contribute in a deeper way and expand what their teammates have been doing because of that new knowledge. But we do, and again, we work individually with students. You know, if their fourth year ends up being their fifth year, they can show up to the UMed fourth year policy and advocacy forum with some folks that they don't know as well in the cohort behind them, but they can still participate, and we do our very best for them to. I think over the years, we've maybe had 2 students withdraw from the program because of other competing things. But you know, for a program that's been running for 15 years, I think that's pretty good, and students figure out, and we figure out how to support them and make sure they succeed. So the MD and PhD, that's a lot. If you really think you're going to take all of it on, I think as a mentor, I think some of our role is to tell students to scale back. I think that we're always willing to explore that, but that may be. I don't know that I've had a lot of MD, PhD students is kind of a different level of complication in terms of scheduling and so forth.
I'll also add too, I mean, in addition to degree programs, you know, I'm always impressed and surprised by many of our students in all of the concentration programs. Oftentimes they are active in student government, in leadership roles in other student organizations. So, you know, I think motivated students are able to get find their tribe and get interested and get involved in a variety of things, not just in the concentration programs, but also in other activities that are available for enrichment in the College of Medicine too.
Yeah, I would just add that our UMed students do UMed and do a lot more, and students that are not in UMed also do a lot more, and there's a lot more to do. So I don't think any of these programs exclude you in any way, whether you're in them or not in them. I think they just enhance and allow you to go a little bit deeper in certain areas.
And we have a specific question for our only student here, for Kate. So how do you envision impacting the delivery of healthcare through your experience in your study with UMed?
Very difficult question.
It's nice and open-ended for you.
It is nice and open-ended. So, honestly, I feel like personally, I haven't planned my professional goals that far out. I can speak a little bit to my UMed project. So our project currently is more research-based. So our mentor, he works in the College of Applied Sciences, and we developed a research program with him to examine barriers to care for African-American patients with heart failure, specifically examining how they follow a low-salt diet. So, we were the first. My group was the first one to propose this research question, and he was a very helpful mentor in terms of helping us evaluate like the current literature regarding this issue. He works a lot with mobile health technologies. So we got partnered up with him to kind of help out with his current research projects, examining, these similar mobile health technologies specifically to patients, like cardiac patients. So coming in from that experience, I learned a lot about how to write like an IRB proposal, how to get that through an institution, how to do research ethically and correctly, and implementing that program, I would say, taught me a lot about what I wanted to do in the future, in the sense of, showing me how I can do these things in addition to being in medicine. And it helped me understand that, medicine and research, especially in public health, aren't mutually exclusive. And then there's a way to do a lot of both things. So that project itself, it's still in like the beginning stages. So, to say that we've had an impact necessarily, it's kind of difficult to say, but for me as a scholarly project, I learned a lot from that. And I think I'll take those lessons with me to residency and beyond, in the sense of, identifying a clinical question and then starting the research process to answer it, to make change.
And that's a perfect segue into my next question, which is for all of you here. So during the summer between M1 and M2 year, do students who participate in these programs have the opportunity to participate in research? Do they participate in research in addition?
Well, in the CMed program, it is certainly possible. The time commitment for the summer is not for the whole summer for the CEMed program, and it's highly flexible. So that, yes, there are many students who have engaged in a research project during that summer who also are in CEMed.
That's the same with IMED as well. Many of our students are concurrently participate in the summer observation program for IMED, but then also do research.
And for UMed, we don't require summer participation. We want them to have the time off when they have it, but most students are very ambitious and do a lot of things anyway. And so some of our students have Schweitzer fellowships. Like I mentioned, they apply for other things that sometimes do intersect with our community projects, and have allowed the projects to really expand and grow based on that additional work. But we don't have specific summer requirements for our students. Sometimes they also stay in the community and get involved in other things, so that just to show that commitment, but it's not a requirement of the program.
Great. I know we're at our time, but we still have some questions. So if you, like I said, if you have to jump off, we are recording this, but I want to try and get through as many as we can. So here we go with another IMED question. What are some examples of previous or current opportunities for collaborations between IMED students in Chicago and other areas, med tech areas like Silicon Valley, Raleigh-Durham Research Triangle, etc.?
Ooh, that's a good question. The opportunity hasn't come up to work with other institutions in that capacity, so we're not averse to it, but it hasn't come up. We do. I did put in the chat, but we do have relationships with the Chicagoland MedTech ecosystem. So, and that's a pretty vibrant group of people through accelerators and incubators and prototyping facilities around Chicago that the University of Illinois is a partner with. So we're pretty involved with the local community.
Great. Let's just take one more because, like I said, we are crunching a little past our scheduled time here. And this one is for CE Med. So this person wants to know how much of an ability is there for CE Med students to engage with other healthcare workers outside of physicians. And they want to know, does the program allow for students to engage with leaders other than doctors and develop a more holistic perspective of what it means to be a leader for the various professions that are in healthcare?
Yes, it's not only possible, it's strongly encouraged. One of the examples that I gave was the work with the Winnebago County Health Department on vaccination status. And that was a group of 3 CE Med students, and they worked with a whole variety of people in the public health and throughout the healthcare system. So, no, it's strongly encouraged because one of the objectives is to gain insights and skills in relating not only to other clinicians, but to the administrative structure of your healthcare organization. So yes, it's strongly encouraged.
Thank you so much. So I'm going to drop our general email here in the chat. And don't forget, for those of you who are attending today, we have a website that's dedicated to our scholarly concentration programs, and you can visit them here, find out, maybe refresh yourself what campus they're on, what things they might cover. And we also have, and we'll send it via email, an opportunity to attend our scholarly concentration part 2, which is next week at the same time on a Wednesday. So I'll go ahead and drop our general email here in case you didn't get something answered. We tried to cover as many questions as we thought was possible with an audience this size. We had a little over 300 people. So I look forward to seeing everyone next week as we explore a few more programs. And thank you so much to Dr. Kochi, Dr. Michael, Dr. Noreen, Kate, and Dr. Mary.
Thanks, everybody.
Great night, everyone.
Thank you.
Thanks, Kate.